Hi everyone, my name is Dr. Rob Pratt. I'm a Blair upper cervical chiropractor at Arete Chiropractic in Portsmouth, New Hampshire. Today I'm going to be discussing Ehlers-Danlos syndrome, or EDS, and I'm going to review a study done on this condition in chiropractic care. In this video, I'll be going over what exactly EDS is and what common symptoms there are. Then I'll go through the research article and explain what exactly happened in it and what the authors concluded at the end. Finally, I'll discuss why EDS can be a complicated disorder and how chiropractic and upper cervical chiropractic specifically can be very beneficial. Now, what exactly is EDS? EDS is a hereditary disorder that affects the connective tissue of the body. The way that it can affect the connective tissue vary, but the underlying concern is the abnormal structure and function of collagen and other connective tissue proteins. There are also a total of 13 different subtypes of EDS, each having a different set of clinical criteria to aid in the diagnosis. All types of EDS have similar characteristics including joint hypermobility, joint instability, dislocations, which are full separations of the surface of the joint, scoliosis, skin hyperextensibility, abnormal scarring of the skin, and it's more commonly found in women. Now, as far as the symptoms of EDS, pain and fatigue are almost universal in EDS cases, but they can also include the following: joint pain, muscle pain, nerve pain, muscle tension and weakness, loose and unstable joints, hernias, and pelvic floor weakness. It can also affect the skin and cause softening of the skin, hyperextensibility of the skin, scarring, bruising, and poor wound healing. It can also get in and start to affect the organs in some cases as well. So now that we have a general understanding of what Ehlers-Danlos syndrome is, let's now dive into the research article. The article that I'm going to review is called Chiropractic Management of Ehlers-Danlos Syndrome, a report of 2 cases. This is by Drs. Christopher Kologa and Dr. Bradley Polkinghorne. This article was published in the Journal of Manipulative and Physiological Therapeutics in 2003. In this study, the doctors followed 2 cases through chiropractic care. The first is a 49-year-old female who is 6'2", 195 pounds. The patient has been disabled for 3 years and takes 8 different medications, including both anti-inflammatory prescriptions and narcotics. At the time that she initially presented to the clinic, she did not yet have an EDS diagnosis. The second case is a 43-year-old male, 5'10", 160 pounds. His symptoms have been present for over 20 years and had been managed mainly with medications. He had already been treated by rheumatologists, neurologists, and physical therapists without satisfactory relief. The thing that stuck out to me the most about these 2 cases is how different they are, yet they both suffer from the same condition. Now let's talk about the similarities between these 2 cases. Both patients suffered from spinal pain, neck pain, back pain, headaches, and extremity pain. They each had abnormal spinal curvatures, joint hypermobility, and tissue fragility. Both patients also received the same treatment: mechanical force spinal adjustments utilizing the Activator II adjusting instrument. The Activator technique is a very low-force way to adjust misalignments within the spine. The adjustments were also supported with postural advice, stabilization exercises, and postural corrective exercises. The outcomes of the cases. Patient 1 received chiropractic care for 6 months, and patient 2 received chiropractic care for 10 weeks. At the end of the study, both patients reported reduction in pain and anti-inflammatory medication use. There were significant improvements in self-reported pain and disability using subjective outcome measures. At the same time, the doctors noted subjective improvements in both physical examination and spinal alignment. At the end of the article, the doctors concluded that chiropractic care may be of benefit to some patients with connective tissue disorders, including Ehlers-Danlos syndrome. Low-force chiropractic adjusting techniques may be a preferred technique of choice in patients with tissue fragility, offering clinicians a viable alternative to traditional chiropractic care and attempting to minimize risks and/or side effects associated with spinal manipulation. Psychosocial issues, including patient desire to return to work, were important factors in work disability status and perceived outcomes. This is an important conclusion because while chiropractic was very beneficial for both of the cases, the type of chiropractic care was important. The doctors emphasized the importance of using low-force chiropractic adjustment when treating EDS patients. Now we know that EDS is a complicated disorder, and because EDS has varied manifestation, including spinal instability, ligamentous laxity, and spinal deformity, one may think that it would be difficult to improve spinal alignment and spinal stability in these cases. However, in case 1 of this study specifically, they demonstrated notable structural changes in the spine following chiropractic treatment. Now you may be wondering, how is this possible then? So when there are misalignments within the spine, they affect the nerves, which then no longer function properly. With chiropractic adjustments, we can take the pressure off those nerves, and the nerves innervating the ligaments can then function properly. The doctors are suggesting that neurological components to the spinal misalignment plays an important role in ligamentous laxity in EDS cases. Now, the upper cervical spine, meaning the upper neck, is the most neurologically dense area of the spine. This location is where the brainstem becomes the spinal cord, and all communications from the brain to the body and the body back to the brain have to pass through that area. The upper cervical spine is also unique in that it is held together by tendons and ligaments. Because of this area of the spine can be unstable in EDS patients. Due to the complicated nature of EDS and how easily the upper neck is compromised, a gentle, low-force adjusting technique is necessary. Upper cervical chiropractic care is extremely effective in correcting misalignments within the upper neck that are affecting the nerves. It is gentle, low force, and specific. If you or someone you know is affected by Ehlers-Danlos syndrome and could benefit from upper cervical chiropractic care, contact our office for more information. Details are on this slide. Again, I am Dr. Rob Pratt, a Blair upper cervical chiropractor at Arete Chiropractic in Portsmouth, New Hampshire. Thank you.